Okay, apologize for the delays, everyone. We do have everything worked out and we are ready to go.
Okay, thank you very much. We'll convene the Mendocino Council of Governments to order. It's about 1:39. And if we could have roll call, that'd be great.
Okay, Director John Haschek,
Here.
Director Mike Carter,
Here.
Director Greta Connie, Director Jeff Hansen,
Here.
Director Bernie Norvell,
Here.
Director Josefina Duenas. Here, okay. And Tasha Ostrand
Here.
and Chair Dan Jurdy.
Here.
Thank you.
Okay, now we're going to address Assembly Bill 2449, which is notification considerations to receive and address requests from the board members to participate in the meeting.
Yes,
Do we need to take action on this bill?
No, we have not received any requests to participate under the provisions of that bill, so we can go on to the next item.
All right, thanks. We're going to convene as the Regional Transportation Planning Agency, immediately recess and reconvene as the Policy Advisory Committee with Caltrans. And the next thing on our agenda is the consent calendar. Do we have any members of the public who wish to address the board on the consent calendar?
No.
There are no members of the public present here that wish to address the board, and we have not received any requests prior to the meeting.
Okay. And at least on my Zoom, it looks like Councilmember Duenas may be participating by Zoom. I want to know if you can capture her attendance at today's meeting.
She is here in the board chambers, but also signed into Zoom.
All right, thanks. Okay, so we have on the consent calendar approval the February 6th minutes, approval of the February 24th Executive Committee minutes, approval of the third amendment to the Transportation Overall Work Program, the Technical Advisory Committee recommendations of February 15th, and acceptance of the MCOG audit. Would someone like to make a motion to approve the consent calendar?
I will make a motion to accept the consent calendar as written. Haschek, second.
Okay. Do we have any discussion on the motion? All right, not seeing any. Can we have a roll call?
Director John Haschek,
Yes.
Director Mike Carter,
Yes.
Director Greta Connie,
Yes.
Director Jeff Hansen,
Yes.
Director Bernie Norvell,
Yes.
Director Josefina Duenas, Tasha Ostrand,
Yes.
and Chair Dan Jurdy.
Yes.
Thank you.
Okay, do we have any public comments on non-agenda items for today's meeting?
And we still do not have any public present here in the board chambers and did not receive any comments under public expression prior to the meeting.
Okay, I'm not seeing any hands raised in the Zoom. So then we'll go on to the regular calendar. We have presentation of the mobility solutions for rural communities for inland Mendocino County.
Yes, so this project, Mobility Solutions for Rural Communities of Inland Mendocino County, is a grant-funded project that we have partnered with AMA Transportation Planning to conduct. We've been through a couple rounds of public outreach and got a lot of feedback for potential solutions and what needs need to be filled in the communities of Covelo, Laytonville, Potter Valley, Hopland, and Brook Trails. Some of the board members participated in that initial public outreach, and our consultants have developed some draft recommendations or possible recommendations, and at this point are seeking board member feedback before completing this step of the project. And so they are here today joining us, and we appreciate it because I know it's been quite some rearranging of schedules to get them here today. So I'll hand it over to the ALMA team to give us their presentation.
Thank you, Ms. Barrett and Selena. There we go. Well, thank you, directors and members of the board, MCOG staff, and Caltrans. We really appreciate this opportunity to speak with you today at this stage of the study. I'm Heather Menninger here with Selena Barlow, Dennis Brooks, Valerie McIntosh, and our colleague Cliff Chambers. I think not able to be with us, but we bring collectively decades of experience with small urban and rural communities that typify Mendocino County. And I think that our approach exemplifies vigorous public engagement, rigorous pragmatism, and getting to solutions that are tested in a variety of places. What we'd like to do with our time with you today is just review why MCOG undertook the study and how we approached it, what we learned about the 5 communities, their commonalities and their differences, and then share with you our developing recommendations as we move forward to prepare an action plan, but we wanted to get your input prior to that. The 5 communities, as Ms. Barrett has identified, are these 5. They range from the small Potter Valley of less than 400, as you well know, to Hopland and Laytonville, about 800 and 900. Covelo has about 1,400 within the census designated place, and Brook Trails is the largest for 4,500. There are differences in poverty levels, in proportions of older adults, persons with disabilities, zero vehicle households, but these are all factors that impact the difficulty individuals have in getting to the places they need to get to beyond their home communities. Moving to the next slide. We had several purposes and goals in undertaking this study, as MCOG itself did, recognizing that you've had long-standing unmet transportation needs testimony recurring over time, where you've had to make determinations that these were not needs that were reasonable to meet, given the small population and the difficulties of using traditional transit in making the distances to the small numbers of people there. We also had the goal, both MCOG and the ALMA team, of a bottom-up community-based identification of needs. What do people tell us about what their needs are, and how do we craft solutions to address those? And we wanted to find innovative solutions. Since traditional transit wouldn't work, what kind of new strategies and innovative approaches could we consider? Moving to the next slide, we worked with our technical advisory group, about 25 invited members, and project management team of MCOG to build these 6 criteria for guiding solutions and assessing feasibility. Critical among them are addressing those market needs, those needs that Nafili spoke to, and prioritizing lifeline service over improved convenience. Secondly, building upon existing partnerships. Your county has a lot of strong partners. We don't see this in all rural counties. What can we do to build upon those to encourage buy-in and use of potential service? Third, how can we embrace innovation? What are the new strategies that could help make something possible where it's not been readily feasible in the past? Fourth, recognizing that this is a Caltrans Sustainable Communities grant, we want to encourage reduced vehicle miles traveled, or at least shared ride trip making. Fifth, and most importantly, being financially sustainable. What can we do to ensure that there's a continuing funding base and that the startup costs are not too excessive? And finally, measuring use and costs. What is success and what is failure? Setting up benchmarks. Rural transportation is very expensive, has low productivity. So how can we set up front what it is we're going to measure against to determine whether something has worked? Going to the next slide, this just highlights our approach, which we referred to. We had extensive on-site meetings in August, which a number of you did participate in. Over 100 stakeholders were contacted to help set up community listening sessions. From that, we then developed a series of potential solutions with our own knowledge base and research of other experiences elsewhere in California and across the country. In the fall, we came back with an e-survey process, both to validate the qualitative messages we'd heard in the summer and to test how community members responded to these developing solutions, preliminary solutions. That resulted in those 2 early study products, the transportation needs assessment and the solution feasibility analysis. And then in February, we went back to the communities to get further input on what they heard. And now we're at that gold star place where we wanted to speak to you before we go back to the communities. In terms of what we heard about market needs, importantly, the primary need is to travel into Ukiah and Willits for a variety of lower cost shopping and specific services. In Covelo and Laytonville, that related to having or not having access to a reliable vehicle, or not having sufficient money to put into the gas tank to make these long trips for grocery shopping, getting to medical appointments that were specialty appointments not available at the community health clinics, to the college campuses in Willits and Ukiah, social services or court appointments. For Potter Valley, we heard about youth needing to travel in for college and after school programs, shopping because there is no grocery store there, and certain medical appointments of a variety of sorts. And coming from Brook Trails, although of course it's quite adjacent to Willits, for youth, for adults without access to a vehicle, they needed to connect to MTA. I neglected to mention in my earlier comments that Brook Trails and Hopland are the two communities with some limited MTA service currently. Brook Trails is served by the Senior Center Dial-A-Ride for just seniors and persons with disabilities, and Hopland is on the Route 65 with one trip a day in each direction, traveling once a day into Ukiah and once a day south to Santa Rosa. The Hopland community had shopping needs, also no grocery store there, school, after school and medical, and community college trips. Also, this bi-directional trip need we heard about from employers of individuals, workers living in Ukiah who needed to get to the agricultural, the vintner, the restaurant employment opportunities there. And then in every single community, we heard about out-of-county medical trip needs, largely to Santa Rosa, but not exclusively, where there are specialty services that are not available within Mendocino County and people need to travel to get to these appointments. So with that set of sort of overview of the findings amongst the different communities, we built a series of mobility options. If we can go to the next slide, these potential solutions were not specific, they were specific to each community and did not apply to all communities. As you'll see along the bottom, the 5 communities are listed there, and the 8 different solutions are grouped into 2 groups: lifeline mobility needs solutions and daily transportation solutions. The hybrid dial-a-ride shuttle to Ukiah Lifeline mobility need is envisioned as a once-a-day service across potentially 4 communities: Covelo, Laytonville, Potter Valley, and Hopland. This works as a dial-a-ride in the home community, going around and gathering individuals who have made a reservation in advance, or picking up someone at a single stop on out of town, traveling from Laytonville and Covelo to Willits with maybe one stop there, and then on into Ukiah to different destinations that individuals will have indicated they need to go to. Then over the course of several hours, maybe ferrying them to a second appointment from the doctor's office to the pharmacy perhaps, and then collecting everyone to return them home, a 1-seat ride. The community van, we heard in Laytonville and Potter Valley, there was need for some local community transportation. And across the 5 communities, the volunteer driver mileage reimbursement program was something envisioned to provide a modest reimbursement to the person who needs the trip, to enable them to ask a friend or a neighbor, a volunteer driver of someone they know, to help them get to perhaps largely out-of-county medical trips, which are very difficult to serve. The community ride board is a social media tool to help connect drivers with car with riders who need a ride, share the costs of the trip in a carpooling environment. And the app-based car share is to have a low-cost rental of a car at the local community for driving distances. The 2 daily transportation solutions related to Brook Trails involved scheduled transportation, expanding an MTA service into Brook Trails, or expanding the existing dial-a-ride, which, as I said, is currently for seniors and persons with disabilities, expanding it to a general public ridership. And finally, the work transportation option was a shuttle, either a shuttle between Ukiah and Hopland or some kind of taxi-based user-side subsidy. So with those as the kinds of solutions, we then returned in the e-survey environment to test these. How would community members respond? And with well over 350 responses, over 300 from the individual communities, of concern to us, we got back these results, which service would be very useful. People could choose more than one. So you see with regard to Covelo that 67% selected the green bar, the mileage reimbursement, the dial-a-ride shuttle. 2/3 selected that, but another half and 40% selected, 46% selected the other options. In other words, however can we get out of town, it's going to be very useful to our community. In Laytonville, the community van was the red bar, and it had slightly higher levels than the other options, but again, fairly high interest and saying that these services would be very useful by and large, the lowest being the app-based car share. In Potter Valley, somewhat lower levels of interest in terms of what would be very useful, but still between high 30s and 48, almost half of the population saying very useful. In relation to Brook Trails, 2/3 of the respondents indicated that expanded MTA service would be very useful, and 43% said that expanded dial-a-ride would be very useful. And finally, in relation to Hopland, the green bar is the dial-a-ride shuttle, 59% there, and the brown bar on the far other side is that shuttle option for workers between Ukiah and Hopland. Again, a bi-directional service. Now, when we returned to these communities and said, okay, if you could only have one, if you choose one, what would be the responses? What would be most useful and the preferred solution for yourself or your household? Slightly different pictures. In Covelo, the dial-a-ride shuttle rated highest, 48%, almost half, and the volunteer driver mileage reimbursement came in second. In relation to Laytonville, while the community van had been highest in terms of an array of service choices, when pressed to push one, they came down on the dial-a-ride shuttle with the volunteer mileage reimbursement in the second position. In terms of Potter Valley, again, the dial-a-ride shuttle was the top rated, and the others sort of fell into place behind that. For Brook Trails, the response to the schedule expanded MTA service fell slightly to 49%, and expanded dial-a-ride was in the second position behind that. So the two MTA-based services were seen as the preferred solution. And finally, for Hopland, we continue this sort of split picture. Work transportation for 38% was indicated as most useful preferred solution, and the dial-a-ride shuttle at 28% was second most, was the preferred solution. I want to say a word about the, first to summarize, go ahead, Selena. To summarize what we are looking at here, that's a lot of numbers to work through, but the vehicle-based services were the hybrid shuttle, the community van, two types of MTA service, the expansion of the dial-a-ride or the MTA expansion, and a Hopland work trip option, and then three support services, the mileage reimbursement program, the rideshare board, and the app-based car share. Now, when we spoke with community members in the February outreach, we modified this list somewhat because we got back some good and useful input from participants. It became evident that the dial-a-ride shuttle continued to be a strong pull for a number of communities, and the Brook Trails dial-a-ride expansion made more sense in terms of the ability to navigate that complex forest and road network, that was in preference to the MTA service expansion, which really should be considered in the context of the short-range transit plan and reviewed in that role. Similarly, for Hopland, we removed the shuttle and user-side subsidy program from the list because it was evident that employers are working hard to pay higher wages. They can't add the additional few dollars that would be needed to have an employer-based subsidy on that kind of shuttle. It didn't make sense. So that too was added to the list of services to consider for the short transit plan. Could there be additional frequency on the Route 65 to better serve Hopland community members, residents, and workers? On the support service side of the list, obviously, the volunteer driver mileage reimbursement rated highly, but I'll say a word about that in a moment. That remained on the list along with the electronic rideshare board. We removed the car share service because there were just too many problems in trying to implement that and too much concern about whether that was going to be viable. We added a college student trip solution because it was clear that we didn't quite have something there in terms of the options we were offering. With that, we'll just look for a moment at what the college student results were from the e-survey process. You'll see in the green bar to the right that between a third and up to almost 60% of respondents indicated they had need to travel to college. So ranging from Hopland, 59%, almost half in Covelo and Laytonville of the respondents had need to travel to college, and a third in Brook Trails and Potter Valley. But when we asked them which of their preferred solutions, what we got back was that they were interested most in the volunteer driver reimbursement or the dial-a-ride shuttle. Neither of these options will really serve college trips well, because college trip is usually a couple of times a week, maybe 3 days a week, at times at which classes are meeting. It's not going to be well served by a 1 day a week service of the dial-a-ride shuttle, nor the volunteer driver reimbursement program, which envisioned a couple of trips a month at the levels at which we were anticipating that would happen. So we still have need to get to some additional solutions there. So in terms of moving forward, this gives you a grounding in the key highlights we've learned, and I'll turn it over to my colleague Selena now to share with you what our thinking is about how we respond to these. And you are muted, Selena.
And now I'm unmuted. So hello, everyone. Well, now that we know what kind of solutions will meet the identified needs, our next step is to find a way to fund and implement those solutions. And this really presents three challenges. The first challenge is that no single strategy will be sufficient. This isn't going to be an implement one simple little program and we're done type of project. Our research clearly demonstrates that we need to implement a mix of low-cost services to address diverse needs across the communities and within each community. The second challenge is finding sustainable funding. That's not easy. There are limited funding options beyond those already used by MTA, and particularly for general public services. And grant funding of pilot projects is unreliable. It has the potential to build expectations within the community and then not be sustainable. And these are long-term unmet needs that aren't going away. So we want sustainable solutions. And then finally, leadership. MTA is currently focused on rebuilding its existing services that were decimated by the pandemic. MCOG is a planning agency that is reluctant to take on an operations role. So who will lead the development of rural mobility services? We'd like to propose a possible solution for this board's consideration. And that is the establishment of a Mendocino County Rural CTSA. Now, CTSA stands for Consolidated Transportation Services Agency, and it's an entity that was authorized under the Social Services Transportation Improvement Act of 1979 to improve transportation service required by social service recipients. These are the very individuals who need transportation in our study community. So the CTSA is an appropriate vehicle for addressing that. A CTSA can take one of many structures. It can be part of a public agency, it can be a private nonprofit, a JPA, a variety of other things. However, the RTPA cannot be a CTSA because the RTPA's role is to establish and allocate funding to the CTSA. So the RTPA, this board, can allocate up to 5% of the county's TDA, Local Transportation Fund, to CTSA operations. And just to note, there actually can be more than one CTSA designated in a county to focus on different priorities. So how we are envisioning it, the rural CTSA would specifically focus on rural communities outside of the MTA service area and would have characteristics that would allow it to address those three challenges I just went over. First, it would have sustainable funding through the earmark of a small portion of LTF for rural communities. This funding would provide a focal point for securing additional funding from other sources, which Heather's going to discuss in a few minutes. The second thing is that it would provide leadership. to build local support and utilization of these various mobility options, and to engage local and regional partners in providing support, funding, and other contributions. So it would be the leader that is needed to implement these services. And finally, its full focus would be on establishing innovative mobility solutions that would address the small scale demand in these communities with affordable solutions, things that are not traditional transit service. It would also be in a position to evaluate the effectiveness of the mobility solutions that are implemented, and then to adjust the service mix over time, because it would be an ongoing process. So here's how we see it working. The MCOG board would establish a Mendocino County Rural CTSA and would allocate some portion of the LTF, up to 5%, to the operations of that entity. The organization would then be led by a rural mobility manager whose sole focus would be on implementing, maintaining, and promoting mobility services in rural communities that are not served by traditional public transit. Now, a key role of the mobility manager right off the bat would be the pursuit of relevant funding and partnership opportunities that would expand on this core money that was established through the LTF. This pool of resources would then be used to implement the mobility solutions that Heather described a little while ago. Now, some of the solutions would address all 5 of the communities. For example, a countywide volunteer driver mileage reimbursement program for seniors and persons with disabilities could actually be funded 100% through a 5310 grant, which would be something this rural mobility manager could pursue. The rideshare incentive for rural college commuters, that's a little tougher. That's something we envision this rural mobility manager working with partners in the community, particularly Mendocino College, to develop a plan and fund a service that would be appropriate for encouraging students to give rides to other students. Others of the programs would be specific to each community, particularly the vehicle-based options that Heather described. And I'll talk about those a bit more with each community. And then finally, there would be some programs that would be supportive in nature. For example, the rural mobility manager could oversee the community ride boards, which would facilitate ride sharing within each of the communities. They could also disseminate information not only about the transportation services that are provided by the CTSA, but about any other mobility options that are available in rural communities. For example, the much understood and underutilized Medicaid transportation benefit that we heard a lot about in our outreach. That would be an important role, getting out information about that option. Now, different communities are going to benefit in different ways from the CTSA. For example, in Covelo and Laytonville, the 2 most remote communities and the ones where we really saw the greatest need, they will benefit from the mileage reimbursement program and the rideshare incentive for college students, of course, but they also will benefit from the acquisition and operation of a vehicle to provide the 1 day a week dial-a-ride shuttle service that Heather described from each of the communities into Ukiah. And then on other days, that same vehicle and driver might provide community van service within the local communities, within Laytonville on 1 day and Covelo on another day. Potter Valley would benefit from the countywide programs, but in Potter Valley, the Family Resource Center already has a vehicle that they're not able to operate because they don't have any funding. So the CTSA might provide gas and insurance money to allow them to operate that vehicle as a community van, something they're really interested in doing. In Brook Trails, they would benefit from the countywide programs, of course, but also there would be the potential to provide some additional funding to the senior center, which is now funded through MTA, to expand their dial-a-ride service in Brook Trails, possibly to provide some general public trips or to expand the hours of service, as was expressed a desire by the seniors and persons with disabilities there. In addition, as Heather mentioned earlier, Brook Trails is really adjacent to the MTA service area, and the SRTP coming up will look at whether or not it is possible for MTA to provide some kind of a deviated fixed route connection that would link the folks in Brook Trails with Willits, which of course was the #1 thing that they asked for. And then finally, Hopland. The CTSA's role in Hopland would be primarily the countywide programs, the mileage reimbursement and rideshare incentive. However, Hopland is actually within MTA's service footprint, and the upcoming SRs, and used to have more service connecting it to Ukiah. So the upcoming SRTP will very likely consider additional trips on the 65 that will allow folks from Hopland to get into Ukiah. Right now, the one trip that goes through there each day will only take them to Santa Rosa and back. It will not facilitate a trip to Ukiah because it's going in the other direction. So each community will benefit in a different way. But we believe that the rural CTSA, with a core of their LTF funding, can really facilitate a mix of mobility services that will address the needs that we heard about in all 5 of the study communities. And some of the programs, such as the ones I've highlighted with the yellow boxes here, actually have the potential to go well beyond these 5 communities and serve other rural communities in Mendocino County, where we know there are needs that go beyond the scope of this study. So in a few minutes, we're going to open this discussion up so you can tell us whether you think a CTSA is the way to go. But assuming we agree that a rural CTSA is a possibility, the next question that we need to tackle is where to house it. And we believe there are 2 reasonable options. One option is to house a CTSA within the transit authority. You're all very familiar with MTA, which provides public transit service in the more populated areas of Mendocino County. Another option is to house the rural CTSA under a nonprofit community organization, and specifically the Family Resource Center Network. Most of you are probably familiar with the Family Resource Center Network. It's a group of 9 community-based family resource centers, 3 of which are actually located in the communities that we studied. And so we had an opportunity for a lot of conversation with them. They work together to help individuals and families access services in rural communities. And we all know that transportation is one of the big barriers of getting people to services. So it's kind of a natural extension for them. They're strongly enmeshed in their communities. They work collaboratively with other organizations such as Public Health, Human Services, First 5, the Community Foundation of Mendocino County, and others. And it's for these reasons that we think that they offer an excellent option for housing the rural CTSA. So next, I'm going to look at the benefits and challenges of each of these options. So let's start with MTA, the benefits. They have the existing infrastructure for vehicle operations. Obviously, that's what they do. They're a county-wide transit authority, although their current services focus on the more populated areas. They have institutional expertise in public transportation. They're currently designated as a CTSA, although they're not really providing much in the way of services under that designation or allocating any money to it. They do have that designation. They have demonstrated the ability to partner with other organizations in the past through their innovative partnership with the senior centers. And they do have the upcoming SRTP process, which could address this study's recommendations. Now let's look at the benefits of the Family Resource Center. They also are a county-wide network with an existing administrative structure. They've got a lot of its success pursuing, being awarded, and then administering grant funding. So they have that behind them. They are already a focal point for local relationships and partnerships. That's probably their greatest strength, is they're already in these communities. They know who the players are. And in the case of Covelo, Laytonville, and Potter Valley, they are already working directly with the folks who are most likely to be potential transit users. And so that gives them a great leg up for communicating and building ridership of the services. It also gives them the flexibility to identify and respond rapidly to community needs. And then a final benefit is that they have a lower cost structure because they are a nonprofit, which means that they could take the relatively modest funding that we're proposing and make it go further. And the rural mobility manager would likely be someone who lives in one of the rural communities, which would have a number of advantages. Now, challenges for each of these organizations. For the MTA, at the converse of the Family Resource Center having a lower cost structure is they have a higher cost structure and more rules and requirements that come along with federal funding for the public transportation services that they deliver. Their mission right now is focused primarily on the populated areas of Mendocino County rather than these very small communities. The SRTP is likely to be focused on building back ridership within the existing service footprint. And any decision about whether to expand that footprint to include some of these rural communities would likely be at least a year out, if not more. Now, challenges for the Family Resource Center, the big one is that they have very limited transportation experience. They would have startup challenges, the obligations of finding vehicles, figuring out how to maintain those vehicles, hiring and training drivers. But we've spent some time with them and they seem to be a very resourceful organization. James Shields Spence has already suggested some possibilities, such as sharing underutilized vehicles that are currently owned by the health services, looking for ways that they could make this little bit of money go as far as possible. Also, the mobility manager will need to identify and pursue supplementary funding to stretch the FTA allocation. And that's something that the MTA would likely need to do as well. And that's a really good segue for me to hand it back to Heather, who's going to talk a little bit about what some of those other funding possibilities would be and how we could leverage them.
Thank you, Selena. So yes, so we're talking about an earmark that's targeted to rural communities, providing a focus and a focal point, a foundation of funding on that, and that then leverages other kinds of opportunities. These are largely discretionary. There are challenges to discretionary money, but by the same token, they do create other possibilities. The most likely among them is the FTA 5310 program administered by Caltrans for seniors and persons with disabilities, which could be a very strong piece of the overall CTSA program. There are opportunities around the FTA 5312 public transportation innovation for innovation in demonstration and deployment projects. At the federal level, also the RTIP program, Rural Transportation Assistance Program, provides small community ride grants for projects just like some of the kinds we're describing here. We were very excited early in this project about the California Air Resource Board and its clean mobility options, the potential for 5 years of capital and operating money as it works to introduce electric vehicle technology to rural communities. This is still a highly likely possibility for subsequent funding cycle, perhaps even next year. Our concern in this cycle was that the technology wasn't quite where it needed to be to ensure there was enough range to come all the way down from Laytonville and Covelo and make it back safely. So while we wait for the technology to catch up, that remains a good option downstream. And then as Selena indicated, local partnerships and donations, again, because we're a consultant team coming in from elsewhere in the state, we won't have the time or the local trust needed to build the kind of partnerships we think can leverage what I sometimes call, with great respect, bake sale transit. It's small scale, small programs providing few number of trips, but partnerships can make a really big difference in building that kind of transportation. And then just moving back to the 5310 program to give you a sense of what that would involve, going to the next slide, thank you. A grant for 5310 funding that could be submitted for sometime early in 2024 in all likelihood could fund half of that mobility manager position Selena referred to. It could fund 100% of the mileage reimbursement program, where it's targeted to seniors and persons with disabilities traveling to medical trips in this kind of couple trip a month in range of trip making. And for that hybrid dial-a-ride shuttle community van, it could fund those trips that met the eligibility of senior and persons with disability, providing reimbursement to the program for those trips. It would require some additional record keeping, but something that could bring in another funding stream to that program. I think this study's documentation will put the Mendocino County and the MCOG board or MTA or whomever might apply for 5310 in a very strong position to bring down that funding in terms of documenting need and describing the possibilities. And then the partnerships, again, which Selena alluded to, and the fact that those have to be built over time. I think that the CTSA can explore Mendocino College partnership opportunities with the tribes, perhaps the Mendocino Community Foundation, ways in which to build that rideshare incentive for the community college students who are clearly an important constituent among the individuals with whom we talked and met. So in conclusion, you've been a very patient audience, just reiterating the advantages of a rural CTSA as this consulting team envisions it, a focal point for leadership on rural mobility as opposed to the more urbanized, somewhat more densely populated areas, establishing a sustainable funding base from which you can then pursue those additional discretionary dollars that stretch the funding, as Selena referred to, creating this opportunity for innovative solutions, creating a laboratory that can test them, but is tailored to each community, and exploring the potential for lower cost operations under a nonprofit. We were, and then most importantly, for those of you that are not associated with these 5 communities, there is potential to address other rural areas of Mendocino County, most immediately through that 5310 funding and building a senior and disability mileage reimbursement program that could go across the county. I think that's imminently fundable and highly justifiable. So finally, we were asked to consider alternatives to a rural CTSA. And as we see it, there are 3. The first is to rely upon MTA's current newly initiated short-range transit plan process to address these needs, to address these rural needs. They do have the challenge of meeting needs within the existing footprint as we all come back from or continue on from this pandemic era. But nonetheless, the SRTP becomes a mechanism for considering these additional needs, perhaps in some ways redoing parts of this study under their umbrella. A second option is to rely upon the individual communities to shape and fund these solutions on their own to some extent. That's what has been happening over time. And it's not clear, and there have been successes with the bans associated with the healthcare clinics. This document may give them ways in which to use those vehicles further. And finally, the last option is to continue the determination that these are needs not reasonable to meet, very difficult to provide transportation out to the distances and to the populations under consideration. So that remains an option this board could take. And so with that, we would like to turn it back to you, Ms. Barrett, to encourage the directors to offer their comments or questions, or however you wish to proceed at this point with some discussion. Thank you for your attention.
All right, thank you, Heather and Selena. That was a lot of really good information. So just a couple things I wanted to add on before we open it up for comment and discussion. So as was mentioned, MTA is the existing CTSA for Mendocino County. And as far as, what responsibilities they have as the CTSA, they have been providing services as the CTSA in their coordination with the senior centers and their transportation programs. Unfortunately, due to insurance restrictions, they've had to cut back on some of the services that they coordinate with the senior centers, but they are still working with those senior centers and working to facilitate their particular program. So I just wanted to clarify that. Also, Amma touched on this, but just wanted to emphasize that it's throughout this study, it's been frustrating to learn how few grant opportunities there are that will fit our needs in these rural communities. So much of the grant funding that's available is geared towards electric vehicles, zero emission vehicles, understandably, but what we've learned is that for these, far-flung communities in our climate and our terrain, the range just isn't there in the existing technology. So those haven't been haven't been good fits for our needs, which has been disappointing. And then the other thing I really wanted to make clear is that the up to 5% funding for a CTSA that has been discussed, that's not bringing new money into the county. That's money that's already coming into the county. So it would be taking, shifting money from MTA's budget to this other use. So I just wanted to make that clear before we launch into discussion. So that's all I have. And I do want to mention this, Loretta's been the lead on this project, so I'll ask, do you have anything else to add, Loretta? I do not. All right. So that's all I wanted to say, and happy to hear what board members have to say about this.
Well, I'll go first, and it seemed like the alternatives weren't very good because it's kind of relying on what's already happening, or just didn't seem sufficient for what we're doing, or to move us in a new direction, right? I like the idea of the family resource centers doing it, and if Jama has an opinion on it of what the possibilities are, I certainly see that as a way to reach out to Covelo and Laytonville communities, and maybe MTA would be most appropriate in Hopland and Brook Trails, since they already have service provided there, and they don't have a family resource center in Brook Trails per se. So I guess, the funding is a really tricky one, because if it's not providing any additional, the 5% comes from somewhere, and I guess it's 5% of 5 million, which would give us the 250,000. So well, those are just my initial thoughts on it. I don't think the status quo is serving a lot of people. And I think that we do need to do more, especially for these medical trips and people without transportation. So
Thank you for your comments. And I'll add one more thing. This is exactly the kind of feedback we're hoping to get. This is not an action item today. The consultants are still, working on finalizing this step of the process. And so this is, the perfect opportunity for that kind of feedback.
So this is Dan over in Fort Bragg. I actually really appreciate the report. It looks actually the most hope I've seen for the rural parts of the county is in your report. You mentioned that Medi-Cal can pay for certain costs, and my general understanding is that social services will sometimes purchase MTA bus tickets. So maybe could you elaborate on, I didn't see that in your PowerPoint. Could you elaborate on what you were thinking in terms of using Medi-Cal funds for some portion of the cost of transportation?
It's been very difficult for California public transit entities to access Medi-Cal funding. It's really on the individuals, and when Selena talked about accessing Medi-Cal, it was really from an information point of view to ensure that they had the telephone number to make the request to get the trip. We heard from one physician in Laytonville that talked about the unreliability of the Medi-Cal vendor. For any number of reasons, one can anticipate they have trouble getting the trips made that they've taken as reservations. But no, this CTSA would be playing an information role, wouldn't be trying to pull down dollars unless that evolved to a place that would take significant bureaucratic efforts. To become a vendor of the Medi-Cal system and provide trips. I think there would need to be a trip making capability first before that could be sought.
But to address his other point that social service agencies might very well buy tickets, if we had a fare on the Dial-A-Ride shuttle, they might very well pay that fare for their clients to be able to get into appointments and to medical appointments. So that would be something. And that's one of those kind of relationship building things that the mobility manager would be responsible for, reaching out to them, making sure that that can happen.
Okay, yeah, and I would think that that would involve both working with county social services and maybe even with the health centers. I saw this was specifically talking with the family resource centers, which may be the best nonprofit venue. But I also assume that we'd want to be outreaching to the health centers because I suspect they could play a big role in this too.
Absolutely.
I can't see if there are any other board members that are raising their hands. And Bernie here in Fort Bragg.
Thank you. You mentioned the time frame implementation for MTA to be about a year. And I apologize, but I did not hear anything about the Family Resource Center and their time frame.
Well, we were speaking about the short-range transit plan process taking about a year before recommendations might come out of that related to the rural communities. And no, we haven't addressed any timeframes with the family resource centers. That's something that could be absolutely a piece of this next development of the action plan if there was direction from the board to consider that as an option, as an alternative to an MTA designated rural CTSA.
Thank you.
And I'll just add on to that to say that and anything is going to be at least a year out, just because of that's how long it would take to get any sort of funding in place. 5310 grant funding, there's not a current call for projects under that program, so that would be dependent on when the next cycle is for that program. And then, of course, the LTF funding is part of MCOG's budget process, so that would be at the earliest next year's budget process where that would come into play.
Chair Jurdy?
Yeah, go ahead.
Yeah, so, I just looked to JAMA for what her capacity is, because we look at the Family Resource Center as the, do all, save all for many programs in our communities. And it seems like, it's great, they'll be able to do wonders with this, but at the same time, their plate's pretty full as is. So I just wonder if you're considering this as an option. And that's directed towards
Supervisor
JAMA.
Haschak. Yeah, we've been on board with the consulting group and MCOG since the beginning of this process. And so I'm the chair of the coordinator of our Family Resource Center network. We're made up of 7 independently operated family resource centers located all throughout Mendocino County. And so I'll speak for myself here at Laytonville Healthy Start. And that is, like, today we had somebody in my office who's undergoing cancer treatment. She's a senior, her husband can't drive. She's asking us for transportation assistance. We don't have a vehicle that we could offer that service, but we could possibly work to coordinate with our local health center because they have a van and they have a car. So maybe one of our staff could drive it. So we're already doing this, work day to day, basically. And also I would just say that the family resource centers are also really primed for sort of being the ones who kind of we get the work farmed out to us. We have worked with MCOG in the past on the Safe Routes to School project. We work with the county in a lot of other different capacities. So I think that the family resource centers could be a viable option to park some of these funding and services, honestly, because we're already doing the work. We just don't have the funding to make it happen.
Thank you.
Do we have any other public comment?
Yes, just a moment. I'm sorry, Director Duenas, I think you might be muted.
Nothing.
Sorry, we are, Director Duenas would like to make some comments, but we've got to get her system unmuted.
Thank you so much for teaching me. Thank you. As you know, I am coming from Puebla, Mexico, and this is a country in development. We have youth in Puebla more than 5 million people. And we have different kind of transportations. We have Metrobus, and we have the public transportation. We have taxis, Uber, and everything. Plus, sorry, we have vans. They are less costly and pretty fast. They pass us every 2-3 minutes because we have too many people in there. So people who are 65, all of them qualify for half price of everything, transportation, and almost for everything. And my thinking is how a country with less possibilities can offer the community a lot of services that are really accessible. So my thinking here is, I used to be in the board of directors of MTA last year, and I was suggesting that as a student going to Mendocino College, I have seen that the buses are almost empty. So we are using a lot of gas, a lot of everything for very few people coming back and forth on the buses. So in regards of the questions and everything that you have been speaking about here, I do believe that the most 100% more reliable people who can offer this kind of services will be the MTA, because they have everything. They have the mechanics, they have the drivers, they have the buses, they have everything, 100%. That will be less costly. Also, the buses that are being not used well, I am not being or speaking badly. I'm just saying what I am saying and what I am doing. So probably we have to make a study how many people commute at certain hours from here to there. So if we have like 20 people, then we have to say, oh, we need a big bus. If we have like 2 people, well, we are going to be needing a small van. So we have to do a lot of research in everything. But I think that also in my country, we have, for example, the Volkswagen, and that industry provides its own transportation for the people who go to work. So they send a bus to different colonies or communities to pick up the thousands of people who work in there. So why we don't ask the people who have the money, who own the vineyards or the big lands that needs the people, the farm workers, to provide money into the MTA or whatever is going to be serving the rural communities? You see, apart from the medical or Medicare or the veterans, so we have a lot of resources, we have a lot of money. If they need workers, they need to pay for also for their transportation. That's my thinking. So that's something I wanted to say about.
Okay.
Thank you so much for allowing me to speak.
Yeah, thank you for your comments, and I think I'll actually ask the AMA team to comment on the part of your comment about asking the employers if they would be able to contribute to employee transportation. They did have some of those conversations with employers, and so maybe they can share a little bit about the employers' thoughts on those.
Thank you. And Cliff, I'll ask you to say a word if you will. I know you've joined us, but yes, we in the last February round of outreach, we did get comments back that it would be very difficult for employers to add to what they're already paying in increased labor expense. Cliff, would you be in a position to talk to the kind of level of cost that they would need to add in the way of a supplement to make a specialized shuttle work?
Well, this, we did discuss this in Hopland it came up during the original outreach. And we did some follow-up, and just because of some of the problems that they've been having with their employers, we just said, if we could get the employers to contribute at least part of this, would this be something that they would be willing to do? And we just did some back of the envelope numbers, but there wasn't really the strong interest to go forward with that. So we didn't pursue it any further. And I believe Hopland was the only community where that was discussed.
In all of the other communities that we looked at, we're looking at very small populations. So not populations that would support the kind of services that the council member was describing. And they were largely not work trips that we were looking at. They were people that, elderly people that needed to get to medical appointments. They were young people that needed to get places. They were low income families that needed to get to shopping. So they were a different kind of need than could be addressed with something that an employer would pay for, or with a traditional type of transit service, or even jitney service. The levels of demand didn't rise to the level that you might see in Mexico, where you do have an array of transportation options.
Thank you. So I really understand the needs, but we can have like a partnership. If we have, say, like every hour, a van going to Hopland or to Willis or whatever, and they just come to the station of the MTA, they can transport from the MTA to another car that goes to the clinic, to go to the Peer 3 Center or everything. So nothing is impossible. Everything is possible. We just need to open our possibilities and just keep on working. I understand that the owner of the land will say, oh no, we don't have money, but they need to understand that the farm workers, they get a little money for the day, for the work that they are doing, and they have to pay other people for commuting, $10 going to Hopland and $10 coming back, and things like that. So maybe a way to provide a ticket or something. I believe if they pay or if they buy like 500 tickets, the MTA can go reducing the price. We can work with that.
The problem, council member, is that these areas we're looking at are not within the MTA's service area. I mean, you're absolutely right. The SRTP that's coming up will address how to get more people to use the services they're currently providing. And it might be things like getting people to help fund tickets. But the communities we looked at, particularly Laytonville, Potter Valley, and Covelo, they don't have any MTA service. MTA doesn't go anywhere near them. So these have to be completely new services, different services than what the MTA is providing. That's why this project was so challenging. It's why we're trying to look for other solutions that don't require the MTA to, send buses out to places where they're not going to be productive.
Greta, are you raising your hand in Willits? I didn't hear you anyway.
I think she may be muted. There you go.
Can you hear me?
Yes,
Yeah,
thank you.
Just barely.
I'm having technical difficulties here. My mouse is not working consistently, so I apologize. I just wanted to weigh in. I appreciate the presentation. I appreciate the conversation that's happening I'm not convinced that a CTSA is the way to go for our community. It seems to me we've had difficulty finding directors at a variety of different levels here in the county. And creating yet another agency that will need a director seems like it could be a hardship for us. I'm also not a fan of taking any of the allocation away from MTA. I think it would be much more beneficial for us to find ways to fund organizations like JAMA's to help them in the work they're already doing than to try to create yet another committee or organization that we may have difficulty keeping sustainable. That's all I wanted to say, but I do appreciate the efforts. I appreciate the creative thinking.
So I agree with what Councilmember Khan said. Connie, the one thing I think maybe could clarify is I think I understood that you to say that the designation of this designation could potentially just be applied to an existing organization. And so if I understood it correctly, we not be creating a new organization, but creating a new dedicated funding stream to an existing organization for this purpose. Can you clarify?
That's correct. It's not a new entity. It is a mechanism to provide some funding through that designation.
If you created the rural CTSA within the MTA, it would still carve out money and set it aside for these rural communities. The advantage of creating it within their Family Resource Center and allocating the money there is simply that they probably can make it go a lot further because of their lower cost structure. But either way, both of the options that we recommended worked within existing organizations, not creating a new organization. So thank you for clarifying that.
But I do agree with Director Connie's concern. We have had difficulties in the county in recruiting to fill some positions. So, I think for this to be successful, we'd kind of need to know that there is someone who could, lead this effort at whichever organization it goes to.
Follow-up question, Chair Jardy?
Go ahead.
So thank you for clarifying. I guess then the question would be, is either of the directors from either MTA or the Family Resource Center interested in taking on this additional role to essentially look for additional funding and tackle this problem? Because then that's just adding more to their already big list of things they need to do.
And I think that was the concern of the supervisor in terms of the Family Resource Center. Are we just asking them to do one more thing? I think we heard from Jama that she sees that this is what they're already doing, including seeking other funding sources for a variety of other purposes. So I heard her say that this isn't new. This is just a mechanism to formalize what's already in place and build upon it so that things go to other rural communities beyond these 5 communities. If you can pull in new money through 5310, which would be recurring funding, you would have a very strong application. Those dollars have been increased at the federal level under the infrastructure bill. I feel sure that that would be new money coming to the county, available to all rural residents, depending upon the structure of the program.
And I think an important thing to note is, we should not expect JAMA or, an existing employee to take on all of this. I mean, she might take it on initially, but in time, this funding would allow her to bring in some support, to have a support person that could take on some of these challenges and to be really the point person for rural transportation. I think that's a really critical part of what the CTSA would do, because if we just continue, if Mendocino County continues as it is now, these communities are nobody's responsibility in the way of transportation. They're not the MTA's focus. They haven't, we've involved Jacob and Dawn in all of our meetings. I see they're not here today, but they're got their hands pretty full with their existing service area and, haven't expressed a lot of interest in expanding into these areas.
I do want to commend the MCOG staff. It was Loretta that brought the CARB clean mobility options funding opportunity to us. And she's been playing a steady role all through that until we finally sort of stepped back that no, we couldn't pursue that in this cycle, but we were actively working to do so. And I think MCOG is a significant party to going forward and building something for rural mobility over time. The CTSA entity wouldn't be alone.
And I'd just like to make one correction. MTA's Executive Director, Jacob King, is actually here with us in the board chambers.
Oh, he is. Oh, I'm
He is.
sorry. I can't see who's there. So I'm looking for names. Hi, Jacob.
And if I could also please add, I wanted to specifically let the MTA board know that this item was on today's agenda. And we looked into the Brown Act and saw that there would not be a problem if they attended. So, you know, we don't want them to be surprised at the discussion and at the things that are being considered. So the final report for this project will be brought to the board in August, and we will make sure the MTA board is aware of that meeting also. Thank you.
Does that conclude public comment on this item? Okay, well, thanks for your report and your continuing work on this subject.
Thank you very much for the time.
Thank you.
Yes, thank you for making time for this today.
All right, that takes us to item number 12, which is the Executive Committee recommendations of February 24th, which is approval for extension of professional service agreements with Dow Associates and with Davy Bates Consulting.
All right, thank you. So I will give some background on this, and then I will ask the executive committee members if they have anything to add on to it. So the all staffing for the Mendocino Council of Governments is provided by contract. And there are two contracts, one for administrative and fiscal services, and that is with Dow Associates, and one for planning services with Davy Bates Consulting. These contracts have been in place since they were awarded in 2014 after a competitive RFP process. The initial contracts were for 5-year periods, and each allowed for up to 5 one-year extensions. So we are currently in the 4th extension period, and that expires at the end of September of this year. So after the end of the initial 5-year contract, the MCOG board, with support from staff, went through a longer process that involved an ad hoc committee to look at options and discuss the extensions, and ultimately recommended that the extensions be approved. Those were subsequently approved by the board, and also had recommended a more streamlined approach for following years. So since then, we've been taking that streamlined approach, and so as we have done for the last several years, the extensions were presented to the executive committee in February. The executive committee did recommend approval of these extensions, along with the CPI of 7.3%. And so that is presented today as an option for action. Because as staff, we are the contractors. We do not make a recommendation ourselves. So this recommendation is specifically the executive committee's recommendation. I do want to add that because this will be the last extension period, regardless of what action is taken today, it'll be important to think ahead in the coming months about an RFP process for the following year. So just want to make sure that people are thinking about that, looking ahead. So that kind of covers what I have to say, and I'll ask the executive committee members if they have anything to add.
Well, I'll just add that I'm pleased with the services we're getting, and I think this extension makes a lot of sense. And I guess we will need to figure out if we have an agency that can take the lead on bundling the RFP process. I think last time it was the county, could be the county again, or it could be one of the cities.
Yes, and I think we could talk further and maybe even consider an ad hoc committee at a future meeting to work through those issues. We do have some time, but I think before the end of the calendar year, we definitely want to start looking at that.
And I'll just add that the executive committee was unanimous in approving the extensions and moving that forward with the inflation factor because of the inflation that we've had lately. And so I'll move approval of the recommended action.
I will second.
Do we have any board or public comment?
Not seeing any public comment.
Okay, can we have a roll call?
Director John Haschek,
Yes.
Director Mike Carter,
Yes.
Director Greta Connie,
Yes.
Director Jeff Henson,
Yes.
Director Bernie Norvell,
Yes.
Director Josefina Duenas, Tasha Ostran,
Yes.
and Chair Dan Jurdy.
Yes.
Thank you so much.
All right, well, thank you for everyone. We appreciate that support.
Yes, thank you all for another year of the opportunity to work with you all. We're looking forward to it. And I did want to mention, I don't know if you guys can see that Greta has her hand up, I think.
So sorry, this is driving me crazy, the situation here. I'm having a hard time unmuting and raising my hand. Anyway, I just wanted to say, thank you, Dan, for mentioning that we need to be thinking about the RFP process. I know the county has handled this in the past. I, for one, would be very interested in having one of the cities handle it this time. So I just wanted to put that out there for our future thinking. Thank you.
I'm sure county staff would be thrilled if Willits wanted to handle it. Okay. So, and everybody can think about this, but yeah, we'll create in the next couple of months, we'll appoint an ad hoc committee that can, work on this. So then I think the next item is 12B, which is the executive committee's fiscal year 23-24 budget recommendations.
All right, I'll take that one. Good afternoon, everyone. I'll try to make this brief. This budget will be coming back to you over the next 2 months. I'd just like to report out on the executive committee's recommendation. And it's just a report at this point, no action. So the committee took a look at the initial draft budget presented by staff back in February. And you have my written report all about that. So just some highlights of that. So there are two main funds we're looking at, and that's the local transportation fund, which is the sales tax revenue, which we rely upon for the agency's programs. And that had pretty much a windfall during the pandemic. It was kind of a surprise to everybody, but over the past couple of years, the sales tax revenues came in very high. And so that's starting to taper off now. We're seeing that starting to drop, although the revenues are still quite high. The revenues for fiscal year 21-22, which we just completed an audit that was accepted on the consent calendar today. And that showed that the revenues, the actuals, came in at about $4.9 million. And the year we're in right now, 22-23, had an initial auditor's estimate of $5.1 million, but they've revised that downward. We're going to see a shortfall from that. So the coming year's estimate, that this budget that we're beginning to develop right now of 22, 23, 24 fiscal year is estimated at, again, about $4.9 million. So about the same as the actuals from 2 years prior to that budget. So that's where those revenues are. we're probably not going to get to the estimate. We do see a shortfall coming, but we have some carried over surplus from the past couple of years that can help to cover that. So the other funds we look at are the state transit assistance funds. That comes from fuel taxes, from gasoline and diesel taxes, and that's kind of the reverse situation. Those were very much down during the pandemic as people were not traveling and driving nearly as much. And so those dropped about 20% or so during that period, and now travel has resumed. We're seeing that fund on the rise again. And the actuals for the audit year we just finished, 21-22, were actually in excess of both the estimates and the pre-pandemic actual revenues. So those are coming in very high now, and the new estimate for this new budget is over $1 million, and that's the first time I've seen it that high. So those are very important funds. Let's see, what else I wanted to mention to you. A major part of this budget discussion was how much to reserve for our local transportation fund reserve, and that is for the benefit of MTA, Mendocino Transit Authority. That's if revenues fall short of the budget allocation, or if they have unusual spikes in costs and need to come to MCOG to ask for more funding. That's what that reserve is for. So the minimum of MCOG's policy, this is just a local policy here we have regionally, at MCOG is 5%. But in the past few years, we've been trying to get that number up and make it more useful. 5% really just doesn't go very far. And so in the last year or so, it's been at 15%. So again, the committee has recommended a 15% reserve, and that comes to $735,000. And other than that, the recommendation was for the contract you just talked about, the staffing contracts, to approve the full CPI inflation rate increase. That's Consumer Price Index. So that inflation is up quite high. What is it, 7.2%, I think? So that was built into that proposal for administration and the planning contracts. And as usual, the 2% for the bike and pedestrian fund, and that's about $86,000. And the requested funds for the planning program, which does have other funding sources. We'll be talking more about that in orientation. And that's a target of about 3%. So that's $141,000. And that leaves about $4.3 million available for transit to claim. We've just received MTA's annual transit claim, which is due April 1st, and that's come in. And that is a drop for them in revenues from the prior year, so they are taking a little cut, but remember, the funds have been extremely high in the last 2 years, so they're getting a little bit less. But in conclusion, the total available revenues for allocation from all sources that we have available are estimated at nearly $11 million, and that's expected to rise by several million with the addition of regional apportionments, grants, and funds carried over. And those are the pending items on this one-page summary spreadsheet in your packet there. And so that would be things like the Covelo Trail grant funds are a couple $1 million there that we need to add in, and some carryover, some more of that. And also, let's see, what else? The Federal Transit Administration, a Section 5311 program, that'll come in. That's at least $500,000. I'm forgetting exactly how much. And that doesn't flow directly through our budget, but we do state it here as available for transit. So for the coming year, MCOG will be able to fund programs of the Regional Transportation Planning Agency and Mendocino Transit Authority with a prior year surplus to cover the anticipated shortfall in sales tax revenues, augmented by other funding sources. So that's my report. I'll be happy to answer any questions.
We have no questions in Fort Bragg. Do you have any questions elsewhere?
Well, this will be coming back to you next month. We have a budget workshop.
Okay, that looks like it takes us to
Thank you very
item
much.
13, which is presentation on the MCOG board orientation.
All right, let me get the presentation started here. All right. So I'll try to go through this fairly quickly. I know this is turning out to be a somewhat long meeting, but we wanted to just provide some background information because we do have several new board members joining us this year. So this will be a very summary type information. We won't be doing a real deep dive into any of these, but hopefully we'll give board members some understanding of all of the things that MCOG does. So the Mendocino Council of Governments, or MCOG, is the county's regional transportation planning agency. It was formalized in 1972 after RTPAs were created by the Transportation Development Act. It had actually been meeting informally even earlier than that, but was formalized in 1972. So a Council of Governments, or COG, is a general-purpose regional agency that can undertake any action in which their member cities and counties share in common. And a Regional Transportation Planning Agency, or RTPA, is a county or multi-county entity charged by state law in meeting certain transportation planning requirements. So MCOG is both a COG and an RTPA. Our duties are identified in our Joint Powers Agreement, and those include transportation planning, economic development planning, housing-related planning, and other specific powers authorized by resolution of our member agencies. So the MCOG board includes 2 county supervisors, a council member from each of the 4 incorporated cities, and 1 countywide elected official or public appointee appointed by the Board of Supervisors. In addition to those board members, and Representative Caltrans votes with the board members as part of the Policy Advisory Committee. So the board has officers, standing committees, and advisory committees, as well as some appointments. The officers are the chair and the vice chair. These appointments were made at the February MCOG meeting for this year. Our standing committees are the Policy Advisory Committee, the Executive Committee, and the Transit Productivity Committee. And those will be, the Transit Productivity Committee will be very involved in this upcoming budget development process, or this current budget development process. And then the non-board member committees that are advisory to the board are our Technical Advisory Committee, which is made up of local agency staff, primarily public works or engineering staff, and planning or community services staff. MTA and Caltrans are also part of that Technical Advisory Committee. And we also have the Social Services Transportation Advisory Council, which advises on social services type transportation and is very involved in the unmet needs process. In addition, we have the board has an appointed CalCog delegate that votes with the CalCog Board of Directors. And then we have 2 current ad hoc committees, one for the Covelo Trail Project and our Climate Ad hoc. So as we discussed earlier, all staffing is provided by contract. This displays all of our current staff. On one side, we've got the administrative and fiscal. On the other side, planning services. I do want to note that many of these, it looks like quite a few staff members, but a lot of these staff members are only part-time MCOG staff members. We do provide services for one other county, and so most of our employees are split between the 2 counties, at least to some extent. So just a quick review of our responsibilities, and we'll be going into a little more detail on some of these further on in this presentation. So fiscal oversight and allocations, transportation policy development, advocacy, and I do want to just highlight this because it's not really talked about anywhere else in this presentation, but advocacy is really critical, and it's something that we do as part of our statewide committees and also through workshops and at statewide meetings like at the California Transportation Commission, making sure that there is a rural voice representing rural needs and specifically the needs of Mendocino County at the state, because it's so easy for Sacramento to overlook some of those needs. Other responsibilities include management of the State Transportation Improvement Program, transportation planning, regional housing planning and RENA development, special projects, and the Rural Regional Energy Network. All right, now I'm going to hand it over to Janet for a couple slides so we can break this up a little bit.
Thanks, Nafili. All right, oversight and allocations. As I just talked about a couple minutes ago, we have two different funds that are governed by the Transportation Development Act, that's TDA for short, and that's the Local Transportation Fund from the sales tax revenues. That's the TDA set up the quarter-cent dedicated sales tax for transportation, and the state transit assistance, that's the fuel tax dollars. We do go through a budget process. That's generally from February, which we just started with the executive committee, and also the technical advisory committee looks at the planning program and recommends on that, and works its way through these committees, and a budget workshop in May, and toward adoption in June, and you'll get a document package like this, and it's available electronically. Claims, we pay claims out of the budgeted allocations, the largest one being Mendocino Transit Authorities, and what reports we give those periodically. Fiscal and performance audits. The fiscal audits are annual, and that's by an independent auditor that's required both by TDA and also required by our Joint Powers Agreement, the JPA. And the performance audits are done by an independent consultant every 3 years, and that's a TDA requirement. So that's more of a compliance audit. Public transit, yes, we're involved in that. Oversight of operations. The Transit Productivity Committee looks at that they're made up of two MTA board members, two MCOG board members, and one senior center representative of the 5 senior centers that provide transportation. And so that's a 5 voting member board that looks at, usually meets once a year and looks at performance data. So we get that data from MTA and parse through that by service type and look at any changes and try to figure out what's going on with those and see if there are any productivity recommendations that can be made to make more efficient use of the limited funding that we have. The senior center contracts are under MTA, and I look at those reports usually every quarter and release their funding allocation monthly, and so we're watching that as well. And the Capital Reserve Fund is from the local transportation sales tax dollars that's set aside by MTA from their own budget allocation. They decide how much they want to set aside, and MCOG is allowed to hold on to that if it's matched to a 5-year capital plan of MTAs where they can identify specific projects that they want to use that money for. So you'll see that usually in every budget that they have a set aside, and there's something they're saving it for. The unmet transit needs process. That is a process that is part of Transportation Development Act. Every year we convene our Social Services Transportation Advisory Council. That's our SSTAC, and they generate a list of unmet transit needs, and That's one of the places where this whole mobility solutions project came from is, year after year after year, some of these remote communities were going underserved. And so, we're not found reasonable to meet and all of that. So that's why this planning project came about. So, but there are other needs that kind of work their way up through the process and eventually either get funded or find a way to meet those. Maybe it's by route adjustments or something like that. So that does come before the board as part of the budget. The Transit Productivity Committee takes a look at, well, let's see, I'll backtrack a step. So your SS TAC Council meets, they generate that list. It comes to you in a public hearing every year. We did that just our last meeting in February. So we heard from the public and all the needs we could scrounge up onto a list. And then that was accepted by this board as testimony. It was handed off to MTA. And now Jacob here has got to go through that list and make sense of it, kind of prioritize and categorize and see what's feasible or not. Brings that to our transit committee, and you're going to get a recommendation out of that committee. And if anything is found reasonable to meet, it goes in the budget. So I think I've mentioned the salient points on that slide there. I'm trying to move through this pretty quickly because I have so much material today. So
It's a lot.
yeah. So, okay, moving on to the next slide, we have the Surface Transportation Block Grant Program. Used to be called Regional Surface Transportation Program. It's from federal money. And, we don't have a lot of federal funds. And if we do, it comes through Caltrans. So what's been customary is to exchange these for state funds or more flexible. We don't have to administer federal funds. That's another kind of bar to reach. So we keep those state funded, and that comes from the, an act of Congress that does the transportation funding authorization every 5 or 6 or 7 or longer years. We used to have ICE-T, MAP 21, the FAST Act, and now the current one is the IIJA, and that is the Investment in Infrastructure and Jobs Act. So that's the current federal authorization for all transportation funding. And so there's one little program we get out of that, that we get directly, and that is a section of this Surface Transportation Program, which has a lot of things in it. We get a little piece of it, and that is what it runs. Okay, it's 1.3 million, and about $500,000 goes to the county directly, and we get the rest is about 800,000. So this board over time has established several programs we manage internally out of that by just local MCOG policy, and that's the partnership funding program you see there on the slide. And that is for projects of regional significance. Maybe they cross jurisdictional boundaries. It's not something that, a city or a county can do on their own, or maybe it just needs pooling of funds. What are some examples of that? The first one was the Simpson Lane roundabout. It wasn't getting done, but by putting together county funds, MCOG funds, and Caltrans funds, that got done. So that's the type of thing that we do with that. At the Coblo Trail, it's a huge project for us, and that's where our matching funds to the state grants have come from, this partnership funding program. The other one, the next one down, is under the same funding source is regional project management local assistance. What that is $90,000 a year goes towards a staff position at MCOG, and so an affiliate has an employee that assists our local member agencies, the cities and the county, with the programs that come down through MCOG. And the last one, but really the largest one, is the formula funding that MCOG chooses to pass through to the cities and counties. And that is really 3/4 of that pie. So most of it does get passed down. And it's really valuable to those local governments because it's the most flexible funding source that we have. It can be used for almost anything that is transportation related. So according to the California Constitution, Article 19. So they use that for quite a lot of things. And sometimes it's streets and roads, or it could be something else that nothing else will fund. So yeah, I guess I did have that on the slide, the estimate of funds we get there. So that's what that program is. Looks like I skipped ahead too far. The 2% bike and pedestrian program, that is coming out of our local sales tax revenues, the LTF, Local Transportation Fund, and it's optional. And it's 2% after administration is taken off the top. And it's not a whole lot of money. It's been averaging about $80,000 a year, but it is valuable to do things like match state grants. So MCOG accepts proposals and basically gives a grant to member agencies that have a need for that. So we usually do that every couple of years when there's a little bit more, we put 2 years of funding together, it's worth doing that process. And the planning funds, those, as I mentioned earlier, is about 3% of the annual local transportation funds, and those go into your transportation overall work program, which you just had on consent calendar today. And those are combined with quite a few more other available sources for the planning program, which Loretta will talk to you more about.
All right, I've got one slide before I hand it off to Loretta. So a couple other funding programs that are administered by MCOG. One, and this is one of our larger capital funding sources, or the largest capital funding source, is the State Transportation Improvement Program, or STIP. We do have another agenda item where we will talk more about this, but just very quickly, it is capital funding for construction type projects. The STIP is something that's adopted by the California Transportation Commission the spring of every even year. It includes 25% of its funding that goes towards is available for programming by Caltrans, and then the other 75% is programmed by regions. In order to program the funding that is available to our region, we develop the Regional Transportation Improvement Program. We do that in the fall of every odd year. So that's something that we'll be starting it this summer when we get a fund estimate from the state that tells us how much money we'll have available. And then in between those funding cycles, we've got ongoing management of that funding program that includes, amendments, allocations, extensions, and just making sure that projects are moving along as they should to meet their timeline. So then one other funding program, and this is kind of an example of typically what happens with the new federal transportation bills is that there will be some smaller pot of funding that becomes available just specifically for that bill. In the last one, we had the Highway Improvement Program. This time we've got the Carbon Reduction Program. It is going to be a pretty small source of funds, or pretty small funding amounts. We are still waiting for the estimates and the guidelines to be finalized by the state, but we expect it to be about $160,000 annually. There should be 5 years of funding, although because we're already 2 years into the current federal bill, we expect that we'll get the first 2 years of funding at the same time. So it'll be all in one funding cycle. We'll have to approve criteria for how those will be used. The state may require us to use it in the more urban areas. That's still unknown at this point. But what the state has identified as priorities for this funding source are bike and ped projects, rail and transit, zero emission vehicle infrastructure, and managed lanes. So more on that to come, but that is a new one that we'll be talking about with the MCOG board in coming months. All right, and now I will hand it over to Loretta to talk about the planning program.
Okay, can I interrupt for just a second?
Sure.
Maybe we should mention, maybe you did say that, but this is not, the STIP doesn't go through our cash accounts. We don't actually see that money. The other funds I talked about are comes through our accounts. We, actually have hands-on, we spend that money. But this is a program that's adopted separately. The
Yes,
STIP is- yeah.
yes, that's correct. The STIP, with the exception of a small portion that comes to us for planning, it is money that's programmed for projects. It's spent by the local agencies typically on those projects and then is reimbursed. But MCOG chooses how those funds are used and then is responsible for making sure that they get used properly.
Thank you. I'm going to just cover a few slides on MCOG's planning program. So the first one is on our Transportation Planning Work Program. We often refer to this as our overall work program, or the OWP. It's an annual program of planning projects funded by the local transportation funds, the state rural planning assistance funds, other funding sources, what we call PPM, planning program and monitoring, and various state grants. So the projects in this planning work program must be consistent with MCOG's regional transportation plan. The eligible participants or applicants to this program are the cities and the county and MTA, and then this program also funds the MCOG planning work elements, MCOG planning staff work elements. The annual work program is reviewed by the Technical Advisory Committee. They review the applications that the cities and the counties submit and make a recommendation, which the board, they make a recommendation on the draft work program, and then the board considers the final work program, and then Caltrans approves after the board approves. So that's for our annual planning work program. You've seen it before. When you see a print copy, the OWP would come to the board, throughout the year when it needs to be amended, and it funds all of the MCOG planning staff work elements. Next slide.
I advanced
Example
it.
of Am I still on? Side am I on? Okay. Thank you. So some example of work elements. We have the elements that occur every year, such as regional government and intergovernmental coordination. These are MCOG planning staff day-to-day work elements. We have a planning, programming, and monitoring element, which does a lot of the STIP work that Nafili mentioned about extensions and allocations and things of that nature, helping local agencies with their projects. We have a training work element that funds training for the local agencies and MCOG staff. And then we have a multimodal transportation element that covers transit planning, working with MTA, non-motorized bike and ped planning, covering the new Great Redwood Trail Agency. It used to be an NCRA element. And these are just some examples that are work elements that are in the work program. And then those are like annual elements. And then periodically we have we have triennial projects to update the pavement management program. And then every 4 years, we have an element to update the regional transportation plan. Also within the work program, we have projects that local agencies submit, as we mentioned. Some examples of those projects are, in the current work program, we have a Fort Bragg Central Business District parking study. Another example of a local project is the MTA Ukiah Transit Center feasibility study. And then the County Department of Transportation annually submits a work element to do special studies. And then just a couple of examples of grant-funded elements. The Mobility Solutions project that you heard about earlier today is a grant-funded project. And another one would have been the SB 743 vehicle miles traveled regional baseline study. That's another example. Next slide. So one of the elements in the work program that gets a lot of use is the grant assistance work element. So MCOG staff does a lot of research and provides information to the local agencies on various upcoming grant opportunities. And there have been a lot of new and emerging grant programs in the last few years. We attend workshops to educate ourselves and to help the local agencies. We review and comment on guidelines, as Nafili mentioned, to make sure that the guidelines don't have any unintended consequences on rural agencies. We just have to make sure that we, look at different things from that perspective. And then MCOG also will apply for grants and administer grant-funded projects on behalf of different agencies. So in the past, some of you may remember, like a local MAC, like Westport MAC asked us to sponsor a grant one time. The Anderson Valley CSD asked us to sponsor one time. And so we'll do that from time to time. And then lastly, we will help local agencies with their actual grant applications as they need it. So a current example, in March, we helped the city of Ukiah with a grant that they submitted to Caltrans. Next slide. We prepare the regional transportation plan every 4 years. That's one of our major work elements every 4 years. It's the major regional transportation planning document that we prepare. It's required. It's a multimodal plan, covers all modes of transportation. It includes policies and needs and recommended actions and projects. It's updated every 4 years, and it includes work with the Technical Advisory Committee, the Social Services Transportation Advisory Committee, the public and stakeholders, and of course the MCOG board, and that plan is adopted by the MCOG board. Other plans that we've been involved with on a various schedule, we've prepared safe routes to school plans through the work program. We did a Mendocino County safe routes to school plan several years ago. We've done 3 different phases of a zero emissions vehicle regional readiness plan in 2013, 2015, and then most recently in 2019, we updated the plan to include an alternate fuels plan. We've done different types of community and corridor plans, examples being Covelo and Walala and Point Arena, and we've done a bunch of others, not just those. And we've done feasibility studies. An example was the 2019 countywide pedestrian needs assessment and engineered feasibility study. And the current mobility study that we talked about earlier is an example of a feasibility study. So these are all things we've done through the planning work program. So I'll hand it over to Nafili.
All right. So in addition to our planning work, we sometimes have special projects that kind of crosses over between both planning and administration. So one example of this was a few years ago, we did a Safe Routes to School non-infrastructure program. That was actually the project that the Laytonville Family Resource Center worked with us on. That was in through contract with NCO to provide services directly to schools to encourage walking and biking to school and teach safety when walking and biking. So that was wrapped up a few years ago. And then our current special project is implementation of the Covelo State Route 162 multi-purpose trail project. This is really unusual for us because it is implementing a construction project. We have grant funding through the Active Transportation Program, as well as funds through the state's Complete Streets program. And after the most recent California Transportation Commission, we have more Complete Streets funding. And so the project is now whole, which is very exciting. So we'll be executing a contract here and moving forward with that project. But those are a couple examples of special projects. One other role that the Mendocino or the MCOG board plays, and as well as staff, is that the MCOG board also serves as the board of the Service Authority for Freeway Emergencies, or SAFE. And that is the agency that administers the call boxes that you see along the state highways. That program is funded with a $1 fee per registered vehicle in Mendocino County that's collected by the DMV. And so through our administration, we provide the planning, installation, maintenance, monthly service fees, and assessment of that system, which is what we're currently dealing with related to changes in the cellular networks. And so that's for that entire system, which includes 45 satellite and 96 standard cellular call boxes. And so the MCOG board meets as the SAFE board as needed. So it's not something that happens every month, but when there's a need for a SAFE board meeting, those will be scheduled in conjunction with the MCOG board meeting. So everything we've covered so far has been very transportation related, but we do have a couple other areas that we work in that are not as directly related to transportation, still related, of course. So one is planning for regional housing. MCOG is the only agency that has regional housing planning authority, and our biggest responsibility is in that area is development of the regional housing needs assessment. This is something that we now are doing every 8 years, which is nice. It used to be every 5 years. And the process starts with a total needed units determination that comes to us from the state that provides us with a needed number of units for our region across various income levels. MCOG then works with local agencies to determine a way to allocate those needed units across all jurisdictions. That's eventually adopted by the MCOG board, and then the local agencies use those numbers, those allocations to develop their housing elements. So we are due for adoption of the next one. We're scheduled to happen in 2026. So, and we'll be gearing up for that in a couple of years. Another sort of newer responsibility that we've got in this area is the Regional Early Action Planning Grant Program. This was created by the state in 2019 to provide funding for implementation of RENA and housing elements. So far, we have only utilized one round of funding. We don't know if there will be additional funds coming for regional agencies. There was a second round of grant funding that was available directly to local agencies as well. And in the funding that we have used, that we are still using, we and the MCOG board opted to sub-allocate those funds primarily to local agencies for projects specific to housing development, and that varied from one agency to another. So we actually, the MCOG board approved a JPA amendment to specifically identify housing just about 3 years ago. However, although it wasn't specifically identified in the JPA, but we've actually had this responsibility for at least 30 years, which is when the responsibility for the regional housing needs assessment was identified. So another non-transportation, although certainly linked to transportation, role that MCOG has is a regional role in addressing climate change. So following the board's interest in pursuing a regional role in this area, staff looked into a couple possibilities for what that might look like. One was creation of a regional climate agency similar to what Sonoma County and Napa County have, and another one was participation in a regional energy network. So when we started looking into those options at the board's direction, we discovered that there was a new regional energy network being formed with several non-contiguous rural counties throughout the state of California, and we were given the opportunity to join in that regional energy network, or REN. So RENs were established by the California Public Utilities Commission to allow regions to design and administer energy efficient programs. Examples of activities carried out by those RENs are rebate programs, workforce training, and technology development. The programs are funded by the CPUC through the public goods charge, and the programs are customized and funded based on local needs. So this rural REN that has been developed and proposed, it was customized to fit the needs of those rural counties that were participating. So that proposal, which was a very extensive application and business plan. It is currently under review by the California Public Utilities Commission. Initially, we had expected action on that in fall of 2022. However, the CPUC grouped it with some other actions that are on track to be approved this year. So now we're expecting that to happen in fall of 2023. So once that approval comes in, that's when our work in that area will really begin. And that was part of the MOU that was the focus of the MOU that was approved in 2022 by the MCOG board, was the participation in that. So that is a summary of what we do here at MCOG and what the board's role is. There is a lot more detailed information available on our website. We've created a board orientation and reference manual section of the website, so that can be found in the About Us section of the website. And our website is mendocinocog.org, so I'd encourage board members to take a look at that. And we're happy to answer any questions. I know that was a lot of words.
Well, thank you, Nafili, Janet, and Loretta for the presentation. We don't have any questions here in Fort Bragg. Any questions in Willits, Point Arena, or Ukiah?
No.
And doesn't look like there are any questions here in the board chambers. Yeah. And we have not received any public comments on this either.
All right. So then that takes us to the 14, which is review and discussion of state transportation improvement program outlook.
All right. I'll try to be fast. So the State Transportation Improvement Program, or STIP, as I mentioned in the orientation, provides capital funding to regional agencies that can be used for a variety of projects. It provides programming of funds in the state highway account, and the way that regions program their share of funds is through development of a regional transportation improvement program. That's something that's developed by MCOG staff, the technical advisory committee, with stakeholder input every odd year in preparation to submit that to the state in December of those years. Then those are ultimately adopted as part of the State Transportation Improvement Program in March or April of every even year. So we'll be gearing up to do that this year. The process starts usually in the summer when we receive a fund estimate, which identifies how much money we have available to program as a region. The STIP covers a 5-year period. However, every new STIP adds 2 years of new funding capacity to the end of the period. So essentially, the funds that are available that are identified in that fund estimate represent 2 years of funding, because the first 3 years of that 5-year period have been covered by earlier STIP cycles. So historically, the STIP has been a major source of capital funding for our region. We had some many years ago. We had some very large fund estimates, and we were able to really do a lot more with those. There were cycles where we divvied it up by percent and said, we're going to use this percent for this type of project and this percent for this type of project. We haven't done that in many years. The STIP is largely dependent on fuel excise tax revenues. So those are the per gallon taxes that are charged both by the state and federal governments. Of course, as fuel economy has improved over the years, that means that those revenues have gone down. The passage of SB1 did stabilize these revenues by adjusting how the excise taxes are established, by changing the amounts of those and then providing for adjustments, which was a huge relief, because prior to that, they had not been changed since 1993. So they have stabilized. However, they are unlikely to reach the levels that we saw many years ago. My staff report includes a listing of the new funding shares that we have received as a region over the last 5 STIP cycles, so since 2014. 2016 was a little bit of an anomaly. That was the STIP cycle right before the passage of SB 1, when those revenues had really reached an all-time low, and the state actually experienced a negative fund estimate. And so we had to deprogram. Typically, though, you can see it ranges between 3 and 7,000. I would say that 7,000 million, that 7.5 million estimate or new funding share in 2018, that was post SB 1 when the state was very optimistic about what those revenues were going to look like. I think now we've sort of reached a point where we'll be fairly stable, and in fact, we've been told by the state as they are starting development of the assumptions that go into developing this upcoming fund estimate, that we should be able to expect something similar to the last cycle. So if you look at our average of those last 5 cycles, it comes out to about 3.8 million if you do not factor in that negative year. With the negative year, it's about 3 million, and again, that's 2 years of funding. So that's what we're looking at for the next, at least the next couple of STIP cycles. So this agenda item today was just to kind of give an overview of the STIP and talk about what we might be able to expect moving forward in terms of funding, but then also to talk about funding policies. So the last time the MCOG board adopted STIP policies, which are used to select the projects that get funded through the STIP, was in 2011 in preparation for the 2012 STIP. So it's been quite a while, and both local conditions and state priorities have changed since that time, and so it was appropriate to review the policies, and if there is interest by the board in developing new policies, that's something that we would bring back for action at a future meeting. But just to give some background, at the time that these were developed, at the time that these current policies were developed, the state was prioritizing capacity increasing projects. They discouraged rehab type, local, road rehab type projects. And I will say that the things have really changed a lot at the state. Capacity increasing projects are now, getting a little echo. Okay. The capacity increasing projects are now, capacity for the sake of capacity is really discouraged by the state, so they've really changed their approach to those types of projects, and some of the needs that we had previously identified in our policies aren't necessarily needs anymore. So these are listed in the resolution from 2011 that's attached, but I'll just summarize very quickly. So the policies that are in place currently were that MCOG will remain committed to completion of the Willits Bypass, phases 1 and 2. Phase 1 was completed many years ago, and if you look back at our most recent regional transportation plan, that is considered complete at this point. Next, it says that other state highway and major local projects will be a priority, and that rehab projects on local streets and roads will not be eligible for RTIP funding. Next, rail grade improvement projects that had previously been programmed but remained unfunded at that time may be considered. That actually went back to the very large fund estimates that we had had years before, when we actually had a certain percentage set aside for rail grade improvements. So that's not really something that is applicable now. And then transit capital improvements identified in Transit Capital Improvement Plan will be considered for RTIP funding. Bicycle and pedestrian projects identified in MCOG's Capital Improvement Program, which would be the action plans of the RTP, will be considered. Bicycle and pedestrian improvement projects are eligible for transportation enhancement funding on a competitive basis. That also is no longer applicable because we do not receive a transportation enhancement target in our STIP fund estimate anymore. That used to be something that it would be included in those fund estimates, was a set aside amount for bike and ped projects. There were also some years when we had a target in our STIP estimate for transit projects. So we have not seen that type of target in the last few years. And then finally, that applications for RTIP funding would be amended to consider policy outcomes of a 2010 workshop. And it doesn't say that in this resolution, but that was in reference to leveraging. So the outcome of that workshop was that the project selection was amended to consider funding that would be leveraged through programming of the STIP funds. So that's a quick summary of the current policies that MCOG has in place. And so I'd love to hear board member feedback and direction if there's an interest in considering new policies for the 2024 STIP cycle.
Well, I'll speak up. I think I'm probably the only person still on the board since 2011. And, given the fact that the state has changed or modified their policies, I think it's at least worth reviewing what the current policies are and seeing if we want to make changes to our internal policies, because it sounds like the state's maybe giving us a little more latitude than we had back in 2011.
Yes, I would agree. And I do want to clarify, the state, back in 2011, they didn't really have a policy that did not allow rehab projects, but how it played out was that when there was limited funding, the state would implement allocation priority plans. And so even though those projects were allowed to be programmed in the STIP, when they came up for allocation, if there was limited funding, which there often was, they would not be allocated. So it wasn't really they weren't prohibited, but they might as well have been.
So it seems to me there's a couple different ways we could do this. We could, certainly any policy changes would need to be adopted by the full MCOG board, but it might be beneficial to have either one of our standing committees or an ad hoc committee work with MCOG staff to get a better understanding of what latitude we have and what's the current thinking of the Transportation Commission, and then bring back one or two options for the full board.
Yeah, I think that certainly makes sense. So we could work with the Technical Advisory Committee, or if there's interest by board members in participating, then we could create an ad hoc or a combination of the two. Does the board have a preference which approach we take, the working just with the TAC or with an ad hoc and the TAC?
Sure. Yeah, I could certainly go back to the Technical Advisory Committee, or it could also just go to the board's executive committee. But yeah, I would suggest maybe it goes to the Technical Advisory Committee first, then a recommendation that would be looked at by the board's executive committee, and then brought back to the full board kind of in that sequence.
Okay, yeah, that sounds like a very good approach. So we can work with, we'll work at staff level to kind of lay out the state's current policies and how those line up with our local policies, because we also do need to consider our regional transportation plan and the goals and policies that are included in that document, and then work with the TAC and executive committee.
Who is on the TAC?
Jacob, let the record show that Jacob's got his hand raised. So we've got, yes, MTA is on the TAC. Do you want specific names or just the positions? We have engineering staff from the City of Ukiah, County of Mendocino. For Point Arena, because they have a smaller staff, it's the city manager that participates. For Willits, it is typically their planner, their planning director that participates. Fort Bragg is engineering staff that participates. And then the county actually has two positions on the TAC, one for the planning department and one for the Department of Transportation. And then Caltrans participates, and MTA.
Okay, so there's no one from the MCOG board.
No board members.
Okay.
It is all staff.
Very good.
Okay. Do we have any other comments on this item?
It looks like we did just get a comment in the chat. So I can go ahead and read that. Okay, good afternoon. This is from Dave Schbach, who he is a member of the Walla Municipal Advisory Council and does often participate in our meetings. So Dave says, good afternoon. I am participating in Point Arena with Councilmember Hanson. The setup here may not allow verbal input without audio feedback or echo. So in lieu of verbal input, please reconsider exclusion of rehabilitation projects from RTIP eligibility. Allowing consideration of rehab of existing arterial or collector roads would help to close a substantial gap between major roadway projects and larger scale or critical roads such as emergency evacuation routes. Thank you. I'm not seeing
Well,
any
thanks
other.
for the input. So it looks like we're ready to go to the next agenda item.
Okay, yes, so we'll come back with that at a future board meeting then. So it looks like we're on to recess.
Yeah, so we'll recess as the Policy Advisory Committee and reconvene as the RTPA. And do we have a motion to ratify the action of the Policy Advisory Committee?
So moved.
I will second.
Okay. Can we have a roll call?
Director John Haschek,
Yes.
Director Mike Carter,
Yes.
Director Greta Connie,
She is.
say yes. Yes, okay, sorry. Director Jeff Henson,
Yes.
Director Bernie Norvell,
Yes.
Director Josefina Duenas, and Chair Dan Jurdy.
Yes.
Thank you.
Okay, that takes us to reports for information. Is there any updates from Caltrans?
Yeah, I do have a couple of updates. I wanted to alert everyone or just pass along that we have a new structure within our traffic safety and operations divisions. Sherry Rodriguez has stepped into Tom Fitzgerald's previous role overseeing the traffic safety permits, operations, and TMS electrical. And Andreas Kraus is now stepping into David Morgan's previous position as the district traffic safety senior. And then Paul Haley is the new senior over work zone operations and mobility programs, and that's formerly known as traffic operations. So if I can provide contact information for any of these people, just please let me know. The Willits Road Diet, it's the section of State Route 20, formerly US 101. The project was selected for the Bicyclist Safety Enhancement Project. This is between post mile 33.15 and post mile 34.21 on State Route 20, and it will install, I guess, 11,600 linear feet of road diet and is approved for $900,000 of HM4 safety program funding. Protect funds, we submitted an application for Protect funds for State Route 128 flood study. These funds are for climate and resilience planning studies such as corridor studies and technical analysis to advance project areas for project initiation document phase. The application would address sea level rise, storm surge, and flood mitigation for an approximate 11-mile section of State Route 128 as it meets State Route 1. There's a total of 2.5 million available statewide, so we won't know how well it competes for a few months, but we'll keep you updated. The fiscal year 23-24 Sustainable Transportation Planning Grant Program. The call for applications closed on March 9th. We received a total of 12 applications, 8 for sustainable communities. That would be 1 from MCOG and 1 from the city of Ukiah, and 4 applications for climate adaptation, and none of those were from Mendocino. But the climate adaptation planning grants, the request for funds was under the amount of funds available statewide. So we're looking to have another round of grant proposal likely this fall. There will be more targeted outreach for this, and now's the time to start thinking about applications and potential planning ideas. So my team and I are available to troubleshoot and brainstorm ideas if there's any interest in that. Clean California.
So Tasha, if we want to have a follow-up conversation with Caltrans to, float some ideas, would we contact you or someone else?
Yeah, me or Dean Meester, the regional planner for Mendocino County, we would both be available for that.
Could his contact be sent to everybody on the MCOG board?
Absolutely, yeah. He is the TAC member on the MCOG TAC, so definitely I can provide that. I really would recommend considering applying because it was so undersubscribed this cycle, which was a big surprise. So I think there'll be quite a bit of funding remaining. Clean California, the local grant program is now open for applications. They are due on April 28th. There was recently a public meeting for State Route 22 Talmadge Road. It was in Ukiah. It was for the Talmadge Road corridor plan. The meeting centered around potential traffic calming measures and improvements for bikes and peds. I was told about 25 people attended, which we considered to be well attended for that meeting. Comments were received and will be considered when developing the corridor plan. And if you or someone you're interested or are interested in submitting comments, I can help direct those. And last, there'll be a public meeting for the Pudding Creek Bridge project. There's no date yet, but we'll keep you posted. And the purpose of that is just to inform the community about project and potential traffic impacts. There's also an updated Caltrans milestone report in the agenda. So if there's any questions, I'm available for that. Oh, I think you're muted.
Oh, thanks for the report. No questions.
Thank you.
I'll just add, so the milestones report was included in the packet. However, we also included the new organizational chart for Caltrans on our website. So that is available for board members to find. We can send that out separately as well if there's interest.
And I think we're already going to have an update to that. So
okay, we'll wait for the
change
new
a lot
one
around here, but we'll make sure you get the most recent one.
All right, thank you.
All right, is there a report from MTA?
Jacob says no report.
Okay, do we have any updates for the Great Road Trail?
Well, yes, this is John Haschak, and let's see, on March 22nd in Fortuna, the Great Redwood Trail had an open house, and then on the 23rd in Willits, and it was very well received. There was lots of people there, lots of comments, both pro and con, and certainly concerns, and people kind of expressing their concerns about what will happen on the far reaches of the trail out there in the hinterlands of the Eel River Canyon. But there's also a lot of, positive comments about what the, possibilities are for it too. So I would say it ran the gamut from very positive to real concerns. That's it.
We have the MCOG summary of meetings. Is there anything there you want to highlight?
Nothing to highlight, but I'm happy to answer any questions.
Okay. Not seeing any questions. Do we have any MCOG staff reports?
Yes, so I'll start with, I did already mention this, but the Covelo State Route 162 Multipurpose Trail Project is now fully funded. The California Transportation Commission approved that funding at their meeting in Los Angeles on March 23rd. Which I attended, yes. So that was really exciting. We're so thrilled, and so we are taking steps to move forward with award of that contract, which was previously authorized by the MCOG board pending state approval of the additional funds. So we've notified several representatives from the community. Of course, as everyone is aware, we've had a very wet winter and spring so far, and so that is probably going to affect when the contractor can begin work, but it will be this construction season, and we'll be working on some sort of groundbreaking, planning some sort of a groundbreaking. So really excited to be moving forward with that, and thrilled for the community because I think it'll make a huge difference. That's all I have to say about that project. And I don't have any miscellaneous. Do you have any miscellaneous, Janet? No. So no miscellaneous items from admin.
Okay, thanks. Are there any reports from planning staff?
Yes, I have two quick reports. They're in your packet. First one is on the feasibility study for MTA's Ukiah Transit Center project. We just wanted to give you an update of where we are with this feasibility study and location analysis project. The purpose of the project is to evaluate potential locations for a new transit center in the greater Ukiah area. So MCOG and MTA staff met last week via Zoom with the consultant team to go over their first draft deliverable, which was a technical memorandum, and it included some initial site analysis data. And then we also reviewed plans for upcoming community outreach. Public outreach for this project is starting this month with the launch of an online community survey and a paper survey also. There are some pop-up charrette events and stakeholder interviews planned, and members of the consultant team will be in Ukiah in April on the 21st at the Pear Tree Shopping Center and on the 22nd at the Farmers Market to do some little pop-up events and gather community input. So we've given you the schedule of the project previously, but I've put it there. And we're just really getting started with stakeholder outreach, and the project goes through November, and we feel like it's a good project that's going to help MTA have some information on their next steps of how to proceed with the transit study. So that's my report on that, if there are any questions. Okay, if not, I'll go into the next report. The next report is on the outreach that we did with ChargePoint for the Rural Electric Vehicle Charging Grant. As we've reported to you in the past, MCOG supported ChargePoint's grant application to the California Energy Commission for some new electric vehicle charging stations. We supported them by agreeing to help with their public outreach process to identify desired locations. We reported in the past that their grant was successful. They were awarded 25 chargers to be dispersed at 5 separate sites in the greater Ukiah area. We planned a virtual community workshop and stakeholder workshop. Those workshops were held in February, and we had an online survey, which was open for about a month. The workshop attendance wasn't great, but it was very well advertised. It included approximately 14 attendees on the community workshop, but 5 of those were MCOG and ChargePoint staff. And then the separate stakeholder workshop, which was geared toward local agency staff mainly, attracted 11 attendees, but 5 of those were MCOG and ChargePoint. But we feel like the survey was fairly successful. We received 79 online survey responses, plus approximately 10 emails with comments on preferred locations. That information, let's see. That information was advertised through email, press releases, posting on social media, and through MCOG's website. I'm currently in the midst of preparing the outreach summary report that we have promised to provide to ChargePoint by the middle of April. And so that report will also be provided to the board in a future board meeting packet. So that's all I have on that. Do you have any questions? And then finally, I just have one item under miscellaneous to let you know that MCOG did work with the County Department of Transportation, the City of Fort Bragg. We had some phone calls with Caltrans, the Noyo Harbor District, and the Sherwood Band of Pomo Indians on a grant application for a Noyo Harbor circulation plan, and that's a Caltrans Sustainable Transportation Planning Grant Project. We submitted that to Caltrans in early March when those projects were due, and we expect to hear in the summer whether or not that grant is successful. And that's all I have. Thank you.
I've got one other planning-related miscellaneous thing I wanted to mention. So we just, a couple weeks ago, received the list of successful projects under the HSIP program, the Highway Safety Improvement Grant Program. And we didn't mention this at a previous meeting, no. So 3 of our cities and Mendocino County all applied for grants under that program for projects that came out of the local road safety plans that were completed through an MCOG work program last year, and all of the local agencies that applied were successful and have been awarded grant funds. So that was great news. Nice to see something moving forward out of a planning project.
Thanks for that update. I guess that takes us to MCOG directors reports. Do we have any MCOG directors that would like to give an additional report?
Nothing here in the board chambers.
Okay. How about the CalCog meeting? Is there anybody want to give a report or a mention about what happened there?
Well, I will. And, I went to the CalCog conference in Riverside, and fortunately it had just rained and snowed in the mountains, and so the air was clean, and the mountains were beautiful. So that was a perk that I didn't expect going to Riverside. But there was a lot of talk about housing and transportation and the planning, and how housing with planning for the future and to reduce vehicle miles traveled, the housing and transportation has to be considered as a holistic effort. And so that was interesting to see what kind of plans for the future they had in creating, kind of these grand avenues or corridors where you'd have people living and working, and transportation, which could be, automatic, whatever you call it, the self-driving vehicles and all that. So I thought it was quite interesting. There was a lot of talk about the legislation in Sacramento being proposed. Certainly, the gas tax and the reduction of gas tax revenue, and with the electric vehicles, there's 1.4 million electric vehicles in California right now. And so if they aren't paying gas tax, how to generate that revenue. So that's it will be certainly front and center, I think, in the legislature, trying to fill that gap. And then the California Transportation Commission did a presentation and what their ideas on for the grand projects. But I am very glad that they focused on the smaller projects like the Covelo multi-purpose trail. And then also, overall, I thought that it was a good conference, but there's a lot of focus on the urban areas. And certainly when it's in Riverside and the Southern California COG and everyone else is there, you know, they're the big players. And so I felt like the rural COGs were kind of off to the side a little bit. Anyway, it was worthwhile. Thank you.
Well, thank you for going and representing MCOG.
All right, well, I think that concludes our business and we can adjourn at 4:13. So see everybody here next month.
All right, thank you, everyone.
Thank you, everyone. Have a great day.
Well, thanks for letting me join here. Absolutely.